My dear students of Medicine and Allied Sciences, I am happy to reach you through this video presentation on revision of histology. I am Dr. J.P. Gunasegaran, Professor of Anatomy at Pondicherry Institute of Medical Sciences and also author of Textbook of Histology, Atlas and a Practical Guide by Elsevier Publication. The slides you are going to see in this presentation are not new to you. You would have already seen these slides in your medical school during histology practical classes. Presentation of this type gives you a quick review of all the slides with points of identification and related questions which are often asked. The whole histology is divided into 18 presentations, each of which is of 15 to 20 minutes duration. So the entire histology can be covered in 6 hours of viewing and listening. Now let's go to the presentation. This presentation deals with cartilage. Cartilage is a firm and flexible type of scleral connective tissue. It is avascular, so regeneration is poor when damaged. It is devoid of nerves, so insensitive. Like ordinary connective tissue, cartilage is also made of cells, fibers, and ground substance. The cells are called chondrocytes and are found in lacunae. The fibers are either collagen or elastic. The ground substance is basophilic and is composed of chondroitin sulfate, glycoprotein, electrolytes, and water. Cartilage is of 3 types, namely hyaline, elastic, and fibrocartilage. This is a section of hyaline cartilage under low magnification. Hyaline cartilage is characterized by the presence of basophilic homogeneous matrix. The matrix appears homogeneous because the collagen fibrils present in it have the same refractive index as that of the ground substance. The other component is the chondrocytes present in lacunae. The young chondrocytes are small and elliptical, found at the periphery of the cartilage, whereas the mature chondrocytes are found in the interior. They are large, rounded, or angular in shape. The mature chondrocytes often secretes alkaline phosphatase, resulting in calcification of cartilage in old age. The cartilage is covered externally by perichondrium. The perichondrium is divided into an outer fibrous layer and inner cellular layer known as the chondrogenic layer. Hyaline cartilage is widely distributed and is seen in costal cartilages, tracheal rings, thyroid and cricoid cartilages of the larynx, articular cartilages, and epiphyseal plates. This is a higher magnification of the same cartilage, showing isogenous group of chondrocytes or cell nest embedded in homogeneous matrix. Isogenous group means the cells are derived from one parent cells by mitosis, and by this process the cartilage grows by means of interstitial growth. The matrix is of 2 types. The newly formed matrix that immediately surrounds the chondrocytes is called capsule or territorial matrix, which is more basophilic and devoid of collagen fibers. The other is the interterritorial matrix away from chondrocytes. It is a old matrix and is less basophilic and contains fibers. This is a H&D drawing of hyaline cartilage, which can be identified by the presence of homogeneous matrix, isogenous group of chondrocytes, and at the periphery you can see the perichondrium, which has got two layers, an outer fibrous and inner chondrogenic layer. This is a section of elastic cartilage under low power. It is stained specially for elastic fibers which appear blue to black. The presence of elastic fibers is a characteristic features of the elastic cartilage. You can also see more number of chondrocytes with eccentrically placed nuclei. The periphery, you can see the perichondrium having two layers, a fibrous and a cellular layer. Elastic cartilage never undergoes calcification. Elastic cartilage is limited in distribution and is seen in ear pinna, epiglottis, auditory tube, corniculate and cuneiform cartilages. This is a higher magnification of elastic cartilage where you can see clearly the eccentrically placed nuclei of the chondrocytes and the two layers of perichondrium. Note the elastic fibers are thinner at the periphery and thicker in the interior. This is a H&D drawing of elastic cartilage, which can be identified by the presence of elastic fibers in the matrix, chondrocytes with eccentrically placed nuclei, and perichondrium at the periphery having two layers, outer fibrous and inner chondrogenic layer. This is a fibrocartilage under low magnification. The fibrocartilage is characterized by the presence of dense bundles of collagen fibers oriented in the direction of the functional stress. Fibrocartilage is also limited in distribution and is seen in intervertebral disc, labrum glenoidale, labrum acetabulare, and menisci of knee joint. This is a higher magnification of fibrocartilage and is characterized by bundles of compactly packed collagen fibers and rows of chondrocytes between the bundles. The chondrocytes are small and uniform in shape, in size. This slide is a longitudinal section of a tendon, and you can see many similarities between the section of a fibrocartilage and a longitudinal section of a tendon. Both have compactly packed bundles of collagen fibers and rows of cells between the bundles. The only difference is here the cells are chondrocytes found in lacunae. Here the cells are fibrocytes or tendon cells not found in lacunae. So keep this in mind to avoid making mistake in identifying the slide. This is a H&D drawing of fibrocartilage, which can be identified by the presence of dense bundles of collagen fibers and the chain of chondrocytes between the bundles of collagen fibers. Of course, fibrocartilage has no perichondrial covering. This is a slide showing the differences between hyaline and elastic cartilages. In hyaline cartilage, the matrix appears homogeneous because the collagen fibers present in the matrix has same refractive index as that of the ground substance, and the matrix is non-homogeneous in elastic cartilage and it contains elastic fibers. The nuclei are centrally placed and here the nuclei are eccentrically placed. Hyaline cartilage undergoes calcification, whereas the elastic cartilage never undergoes calcification. This slide shows the probable viva questions which are often asked during the discussion. Please go through them. With this, we come to the end of presentation on cartilage. Thank you for listening and watching.